Welcome back to another episode of Inspiring Women. I am your host, Laurie McGraw. Every week, I share episodes with incredible women who share their career journeys so that you can hopefully hear something as you aim to make your own impact on this world. Please do subscribe to Inspiring Women to hear from incredible women every week. This week, episode 115, I'm speaking with Joanne Mizell. She is the Chief Operating Officer of a joint venture between Banner and Aetna in the Phoenix, Arizona region. She's a 30-year executive who has spent her career trying to make an impact on the lives of others. Importantly, Joanne actually retired, and she retired, found that through her own health journey with a family member, that it was complicated. When she had the opportunity to dive back in and help impact the lives positively for hundreds of thousands of people in her local area, something very important to her, she jumped at it. And she started working on some of the most annoying but yet complicated areas. Things like complex patient billing. How much do I owe? Things like that. You can learn a lot by listening to Joanne and just hearing her passion and why she came out of retirement to do this important work. So with that, please again, do subscribe to Inspiring Women, but let's hear from Joanne. This is Inspiring Women, and I am Laurie McGraw. And today I'm speaking with Joanne Mizell, and she's the Chief Operating Officer at Banner and Aetna, located in Phoenix. She's a 30-year healthcare executive. She has been working at both health insurances as well as the payer and billing side. We're going to talk to her about some of the innovations that they're doing at Aetna and Banner, like why is billing so complicated? And Joanne, thank you so much for being on Inspiring Women.
Thank you for having me.
Well, it's Heart Day. Go wear red for like Healthy Heart Day. And so I wish I got the memo. You look fantastic, Joanne. Why don't we get started with, your 30 years as an executive in the healthcare space. I know it's like, that's a long time. It's great. A lot amount of time to make an impact. Why don't you tell us what it's like day to day for you as the Chief Operating Officer of Banner and Aetna?
Sure. So our company is Banner-Aetna, and just by way of a real quick background, and we can get more into it later. We are a joint venture company between Aetna, the health insurance company that most have probably heard of, and if you live in Arizona, you've heard of Banner Health, the largest health system in Arizona. And we are a separate insurance company licensed in the state of Arizona. And so my day-to-day, the nice thing about a joint venture as a newer company, as opposed to building something from the ground up, is that much of the services, the insurance services, we do purchase from Aetna. And that has been great for me because it lets me focus more on how to improve things and what to do next and how we take the company to the next level, and less on day-to-day administration. So that still obviously is a big part, is making sure it all runs well. But with Aetna's track record and history and infrastructure, there's tons of support there. So the fun thing about my job currently with Banner-Aetna is that I do get to spend a lot of time thinking about and doing discovery around potential innovation within our industry. And there's a lot that needs to be done. I hear others in the insurance industry that try to defend how everything's working really well. And it's hard to do that because things aren't going well. And as you said, 30 years in the industry, a lot of things have improved, technology's improved, but with that comes quite a bit of complexity, and members are getting more and more confused and kind of lost in the whole system. So my day-to-day, for the most part, is looking at and finding ways to improve, working with our health system partner, Banner Health, and which is just so much easier because we're all part of the same family,
Yeah.
right? We're not in a confrontational or adversarial role like many payers are when working with the health system. We're in a collaborative role, and we just get so much more done that way.
Yeah, well, you have so much experience in the payer side. And so being in this joint venture, that is kind of an interesting new thing. I too am 30 years in the healthcare and technology space. So I've seen the shifts, and certainly payers and insurers have really become sort of like more prominent, and the complexity for the patient who's getting care, receiving care, first of all, figuring out who to see and how, what is covered. There is tremendous complexity there. So I want to talk about some of those innovations. I think that is both interesting, certainly needed, and, what you're doing to be able to make an impact for patients has got to be both how do you do it, but gratifying when you can achieve that. But before we do that, Joanne, you've been in the healthcare space for a long time. My understanding is they had to sort of pull you out of retirement to get back into things. And you've been focused on being locally in Arizona for the past 25 years. So maybe just a quick bio sketch, like what brought you into the healthcare space, and then what kept you there?
Right. Well, like a lot of people, I accidentally came into this space, not thinking it would be, my full career. I actually started working for an insurance company, health insurance company, as a senior in high school.
Wow.
As a part-time job, and I, certainly never thought I'd be here, 30 plus years later, and I am. The industry, just like I said, has changed so much, and I feel, this podcast about women and empowering women, I feel that I was very fortunate to have been at various organizations under women leaders, as well as men who made me feel empowered. And some of it may have been just being naive as a younger person early on. I didn't know any different. And, I was as smart as the guys. And, I never felt like it was keeping me back. But I did have some good role models and people that I wanted to emulate, and then others that I wanted to not do anything the way that they've done it. You learn from both. And just over time, I grew in my career in that industry in a couple different companies. I did work for Aetna for 20 plus years, a long time, and retired from Aetna, thinking I was done. I did a number of things besides that, and just kind of bringing me back from retirement. My husband retired at the same time I did, and he's an avid golfer. So he had plenty of things to fill his time. And I found lots of other things. I did quite a bit of volunteer work. I got involved a little bit in lobbying as a citizen, the local state legislature, on important things to me and my family. And then my husband was diagnosed with cancer. And we engaged as a relatively healthy family. We engaged in the health system the way many people do, not knowing exactly where to go, but my background gave me certainly more insight than the typical patient would have. And it was just really hard, even so. Getting information, I did know people, but you never really know, are you getting the right information? Are you going to the right place? What exactly is going to be covered? It was, for me, very eye-opening, being kind of an expert in the industry and still seeing how complicated it was. So with Banner-Aetna, when I was approached about this position, let's see, a little over 5 years ago, I guess it was, it was a hook for me, and I never thought I would do it. But the hook for me was, our company is trying to fix healthcare in Arizona. And that just, really struck a chord for me because I knew it needed to be fixed, and it needs to be fixed everywhere. But, back to your question about Arizona and all the time in Arizona, it does need to be fixed. But I think if you can fix and improve in one area, a smaller geography with fewer variables, then that will expand and it will spread. And so that was just really intriguing to me. And it was also intriguing that we had the support and the infrastructure of the health system and the payer to do our business, so that we really, the day-to-day of our business, so we could really focus on making meaningful change in Arizona. So that's kind of what pulled me back in.
My gosh. Well, what a story. And, first of all, incredible to have that experience, and hoping that your husband is on a path of health. So that's wonderful, but the experience firsthand to not be able to navigate that with the level of knowledge that you have as an executive in the insurance space. And now to bring that to with the real world view of that patient experience has got to be very beneficial. So maybe Joanne, let's talk about that, because I think that, in terms of this joint venture, when we talk about sort of like the complexity, there's this concept, I think I've heard the term coming from you, called Payvider. So like, not provider, but a Payvider. So what are you working on? What is the innovation that's needed, and how does it impact a patient?
Right. So the Payvider, that term is becoming more prevalent, and you see more about it, and it can mean a lot of different things. In our case with Banner-Aetna, what it means is we're a payer and a provider that got married, and we're creating something new together. So what that does is, as a joint venture, it's a little different than some other Payvider relationships, but as a joint venture, our incentives are aligned. Both companies own half of Banner-Aetna, so they're equally invested in our future and our success. So that gives us a lot of support, not just from the infrastructure and the day-to-day, but we have the support of our board, who is made up of executives from both companies. And they stand behind us, and they push their organizations to support us. So with my many, many years in the health insurance industry and the healthcare industry, I'm no longer dealing with everything's a negotiation. How much can I get and how much will you give, and that sort of thing. Now we collaborate to help each person. So one person to us is a member. That same person is a patient to the health system, right? But it's the same person. And we're really trying to simplify healthcare, make the process of accessing healthcare and getting paid for the healthcare that they need without, breaking the bank for that member. And one of the hardest things in that is just helping them understand how many resources they have as a patient and as a member together. So one thing we did when we became a company was we realized we have two very large parent companies with very ingrained cultures. And we saw really clearly that we needed to create and build a culture of our own that's about innovation. It's not about, a 200 almost year old company and a 50-year-old company. It's about innovation and change. And so we did that, and we used a company that helped us to do that. And we created what we call the Banner-Aetna Way. And the Banner-Aetna Way is a set of fundamentals, we call them, which are essentially behaviors that we ask and expect our employees and our contractors to exhibit as they conduct business on our behalf. And the number one of the 29 fundamentals, I'll read it to you right here, is never forget why we're here: to fix healthcare. The current path is unsustainable. Be courageous and drive the change our industry so desperately needs. Do it for our friends, families, and future generations. Solutions are in reach. So that's our number one guiding fundamental. And that's what we're trying to do, really, is not just create it for our company, but to let it spread.
Well, I think in these relationships and these, payviders, that are out there, certainly complexity, there's lots of cost, administrative cost, and other things. And I think that the financial benefits, you can sort of understand them from a business perspective. Tell me what the benefits are from the patient. And we started this in terms of your inspiration for, why this joint venture was exciting to you, was because of your own personal, experience navigating the healthcare system. What can patients expect? And so, because at the end of the day, when you're dealing with a health crisis, trying to navigate the health system is complicated, and really all of that Banner-Aetna way is less important to the person receiving care, but how they're receiving care and the outcome that they want to achieve is their priority. So what should a patient expect out of, all of that great work that you're doing?
Yeah. So the way I view a patient is, like I said before, a patient really, they go back and forth between being a patient and a member, right? In the same person. And where patients and members get really caught in the middle is not knowing, what's my network? Where can I go? How much do I have to pay? Who's the best doctor? Which facility within the network is the best within that? So those are really quite heavily dependent on the insurer, who lay out the design. We're no longer in the days where you went to your doctor and your doctor told you what to do and you do whatever they do, and maybe you pay for it with a chicken. Those aren't here anymore. So it's just very complex, and patients do worry about, am I going to get paid for this? Is this going to cause me a financial catastrophe?
Sure. Yeah.
And it's hard for them to know, is this the most efficient way for me to get my care? So, for example, a couple things that we've done, and one I think you're kind of getting at is what we call frictionless billing. And I'm really excited about that, because it's not something that we could have created without being the joint venture. We just couldn't have without that level of collaboration. So what we call frictionless billing kind of evolved, creating the solution evolved from some market research on what are the biggest things that patients and members dislike or are confused about with their health insurance. And over, number one, believe it or not, was they can't figure out their explanation of benefits.
Yeah,
and
I believe it. I don't think anyone's going to have a problem believing it if they've been to, seek healthcare at all. It is confusing. And so what was the improvement?
So what we did was, the way it works for most payers is you go and you get your care, and then you wait, and your insurer processes the claim, and then they send you something that says, here's how much we paid. And then the provider sends you something saying, here's how much you owe. And then they have to figure out how to reconcile that and know, what do I really owe? So what we did was take that assignment away from the patient. And we created, instead of doing, you have an explanation of benefit and a bill and you have to reconcile, we're giving them one statement. And it has Banner-Aetna and Banner Health on the statement. We've said, this is your single source of truth. We put on there how much you've already paid, how much we've paid, how much has been a write-off, and here's how much you owe. So they know right at that point in time. And then along the way, as part of that solution, we, as the bill is going through the process of through the insurer and bumping it up against all of the rules, we're communicating typically electronically with that member with a status tracker. We started calling it the pizza tracker, like you order a pizza and it tells you where it is along the way until it arrives at your door. And that status tracker tells them where their bill is. It's been submitted to your insurance company, and so they know what to expect.
Yeah, those simple pieces of communication are so helpful. And I think, quite frankly, that, most people do have an expectation that things should be simplified. I mean, I know exactly where my Amazon purchase is at any, from the second I press the buy button. So, well, that's great. And certainly, I mean, it sounds obvious and simple. I really do appreciate the complexity that's behind it. So thank you for the work in making that better, because I'm sure for patients, bills and the financial burden is some of the highest anxiety, even, right along with whatever the diagnosis they might be dealing with.
Right.
Joanne, let's go back to you. So just, 30 years, again, pulled out of retirement, still, hard at work here. And so maybe some of the lessons along the way. So I'll just give you some of the, types of questions we get from listeners. So maybe a professional win for you along the way that changed the trajectory of your career. Little example.
Yeah. So being a longer career as mine, I can't really point to a specific win that did that for me. And I think that losses have as much of an impact on the trajectory as wins, because it kind of guides you in the direction that you're going. I think some of the what I would call wins have been stepping out and taking a chance when I was afraid, when I felt like I can't do it, this is more than I can take on, and doing it anyway, and being encouraged by others. I think that's something for especially younger women who are, beginning their career. There's often a reluctance to take a new opportunity because you're not ready for it, or I'm not trained for it, and I don't know if I'll succeed. But my experience has been, if somebody asks you to do that, they see something in you that says you can do it. And I've been fortunate to have a number of those kinds of opportunities, not always promotional. Sometimes it's a lateral that gives you broader experience and insight into the business. But then I've, other things that have been mistakes, and you have to recover from them quickly and get back on track. So I can't point to a single win in that category.
Yeah, well, I do think, I agree with you. Sometimes the hardest things, which are not feel goods at the moment, end up being the greatest learning opportunities. Women, executives, at your level, they're always lifelong learners. They're always learning from others. Who inspires you today?
I'm inspired by thinkers that aren't speaking from the rule book. I'm inspired by we have a wonderful team here, our executive team. Our chief medical officer is someone who just makes you think. I think I know where he's coming from on something, and COVID was a time frame during that where there was so much unknown, and he studied and really tried to understand everything in the literature and everything available, and filter it and figure out what's real and what's not real. And but conversations with him, as an example, always make me think about things in ways that I'm not seeing on social media. I'm not seeing in the regular media. That really, I'm just inspired when someone gives me an opportunity to think about something in a way that I hadn't thought of before, and potentially change how I'm thinking about something.
Yeah.
So there's a lot of people like that, and then there's a lot that you work with that you just they're very predictable and even, and you know exactly where they're coming from. But it does inspire me to have my ideas challenged and see things in a different way.
Yeah, I think that's great advice also just for others, just to think about, when you have the opportunity to work with people who don't think and see things the same way you do, that challenges and helps you continue to learn and grow. Joanne, I've really appreciated this conversation. And just as we close out on Inspiring Women, in your time as an executive, I'd just love to hear some nugget, that's meant something to you along the way that you might share with other listeners who are probably at the earlier stages of their career.
Yeah. So I always share this with women who are younger and ask for this, that just based on my career and when I started, women weren't as much in leadership at all. And fortunately now it's a lot better and there's a lot more opportunity. But I still think that the best thing you can do is watch leaders that you respect and admire, and learn from them, but remain true to yourself. Don't become that person. And there's sometimes a tendency to do that, to try to copy everything they do in their mannerisms or how they deal with colleagues and so forth. But you can tell when it's genuine and when it's not. And just learn from those leaders that you admire, and the ones that you don't, say, oh, I got to be sure that's not something I'm going to do in the way I develop myself. So that's a big one. And then the other one I think is even more relevant today in the workforce is a lateral move isn't necessarily a bad move. And think about not just that move when you have that opportunity and turning it down because it's not a promotion. Think about what it's going to do for your future 5 years from now and beyond that. So those are my two little nuggets I would share.
Well, I think they're great nuggets, and we'll close on that. And this has been such a great conversation, Joanne. I really appreciate you taking the time. This has been an excellent Inspiring Women conversation. I've been speaking with Joanne Mizell, and Joanne, thank you so much.
Thank you.
This has been an episode of Inspiring Women with Laurie McGraw. Please subscribe, rate, and review. We are produced by Kate Cruz at Executive Podcast Solutions. More episodes can be found on inspiringwomen.show. I am Laurie McGraw, and thank you for listening.